Hi, you guys. Welcome back for another practice question, just in a different style. You know, I always recommend envisioning yourself with the practice question like the patient is in front of you as you would do in practice. Well, me and my oldest daughter have attempted to recreate one of the practice questions to give you a better idea of what I mean by this. So bear with us. All right, so the question states, a female patient presents to the office today with complaints of hearing loss to her right ear. She states she noticed this recently over the last couple of weeks. She denies any recent swimming. She states she does wear earbuds/earpods frequently. Upon exam, the Rhine and Weber exam were completed. Rhine resulted with AC being greater than BC, and Weber results the sound lateralized to her left ear. Based on these findings, what is the best diagnosis? Hi, Layla. I'm Dr. Brittany Weinstock. You can call me Brittany. I'm one of the family nurse practitioners here, and I'll be doing your workup for today, okay? So, I was told that you're having some trouble with your hearing. So, now tell me, which ear are you having difficulty hearing in?
The right ear.
So, your right ear has been bothering you? When did you notice this? Within the last week, maybe? Or have you had anything in your ear?
My headphones.
Just headphones? Are they standard outside headphones or like earbud style headphones?
Earbuds.
Now, have you been swimming lately?
No.
Does it sound a little muffled when I'm talking now?
Yeah.
Okay. Well, I'm going to do a couple of tests on you. It won't hurt. I know. Every time people see this, they get a little nervous on me. But all I'm going to do is hit it on my hand. And then one of them, I will place it on your forehead, and you'll tell me if you hear equally in both ears or one worse than the other. And then the other one, I'm going to place it behind your ear and then in front of your ear, okay? Think you can do that? All right. So we'll first start with the one that goes behind your ear, okay? All right. So first, I'm going to strike this tuning fork and place it behind your ear. You're going to hear it sound like a vibrating sound. When that stops, tell me. You can either point to me or say it stopped, and then I'll place it in front of your ear, and you let me know if you hear anything, okay?
I can't hear.
You don't hear anything? Okay. And then I'm going to do one other test. Same thing. I'm going to strike it, but this time I'm going to place it in the center of your forehead. Let me know if you hear the sound equally in both ears or if you hear it better in your right or your left, okay? All right.
I hear it.
Okay, perfect. All right, Layla. So I noticed a few things from your exam. You said that right ear was bothering you. I know you've been wearing different earbuds, and you do want to be careful with that. But that's not your problem. So when we did the exam, on one of the exams, what we call air conduction and bone conduction is what we're looking at. Here, your bone conduction was, everything was normal. Your air conduction was greater than your bone conduction. But when I did our Weber exam, when you remember when I put the tuning fork in the center of your head,
Yeah.
you were hearing the sound better and it was lateralizing to that left ear. So that lets me know there's some type of sensory neural issue here, okay? So we're gonna have to take a further look out and see what's going on with that. What we have found here is a sensory neural issue. That can be a number of things, Meniere's, and I'm not gonna confuse you with all the names, but I'm gonna refer you out to ENT. That's a provider that will look further into the ear issue to see what is exactly causing this. But for now, it is something that we would document as a sensory neural issue, okay? All right. So, as you can see, the answer is sensory neural. Remember, when the sound lateralizes to the unaffected ear, it's a sensory neural issue. If it lateralizes to the affected ear, it's conductive. What do I mean by that? The patient came in complaining about her right ear having a deficit, right? But then the sound lateralized to the left, letting us know this was a sensory neural issue and not something blocking that conductive sound. Also, bear with us. We laugh all the time. We did the best we could. I hope it helped. Bye, y'all.